My friends, hello. Today's episode is about which tests a man needs to take. Why is it important to watch this video until the end today? Because unfortunately, most of the time we walk around with a huge number of problems and don't know about them. We rely on test results and normal ranges, assuming everything is fine if nothing is highlighted in red, but that's not always the case. Or the opposite, sometimes we actually think we have a bunch of problems, but in reality, things aren't that bad. Because some people take the test incorrectly. In this episode, I'll tell you first what you need to get tested for to basically check your health. Second, how you need to take these tests. And third, where you should do it. How should you properly prepare for this in general? So that you don't waste your money and actually get real results, not just inflated or underestimated numbers. And of course, some life hacks, tips and hints. I would also say, where would it be best to do this? Why do you even need to do this? You need to do it. Because if nothing is bothering you, unfortunately or fortunately, it never means that everything is good or bad with you. That's why it's better not to wait until you have a serious problem. Because if you already have symptoms or complaints, most often it's already a missed moment when you could have been cured or fixed the situation with minimal effort. That's exactly why we'll start from the beginning. What you need to get tested for in order to protect yourself as much as possible and detect diseases at an early stage. The first thing is kind of an icon, I would say. The first test is a complete blood count with a leukocyte formula. By taking this test, we can see if you have a hemoglobin deficiency, if you have anemia, or if you have any inflammation in your blood. If your white blood cell count or erythrocyte sedimentation rate is high. What about your platelets? Is there any risk that you might develop thrombosis? Most importantly, it's very cheap and easily accessible. And for this test, you don't need to look for any special laboratory. You can even get it done at a regular clinic. All tests require preparation, and all the tests I'm going to talk about will only be informative and beneficial if you do them correctly. Unfortunately, nowadays doctors very often give incorrect recommendations on how this should be done. They say that in the morning you shouldn't eat or drink anything, and you shouldn't exercise or have sex in the morning. Well, I can agree with that. And that in general, you need to switch to a super healthy diet for 2 or 3 days. Cut out all your bad habits. Don't smoke, don't drink. Some even say not to go to the gym for a few days. And as a result, on the day you take the tests, you end up with results that don't actually reflect how you live every day. It's not what actually causes your symptoms. And that's why you're watching this video now. Get your tests done as you normally are. It's also extremely important not to follow the usual advice from doctors to rush to the clinic at 7 or 8 in the morning if you're getting your hormones tested. No, in the morning, sex hormone levels are at their highest. Get your tests done at 11 ante-meridium or 12 post-meridium. Drink water in the morning before your tests, and even during the test. It won't affect your results. Everything you need to change in your lifestyle, well, probably nothing. Just don't eat in the morning. During the day, probably avoid anything that's not part of your regular diet. And probably for 14 to 20 hours. Avoid extremely fatty, extremely spicy foods that are not typical for your diet, because they can really distort some parameters, but not all of them. Parameters such as, for example, a human immunodeficiency virus test or a hepatitis test can really be affected by dietary violations. Or, for example, if you have some kind of skin allergy or skin reaction or a rash, yes, you can actually get a positive test result even for such serious diseases. Here's another piece of advice from me that I'd like to give you. Even if the test shows positive or negative, or good or bad, you should always treat it with a bit of skepticism. Any test, and this is very important to remember, can be a false positive or a false negative. What does that mean? It means that, for example, you have inflammation, you go and get a complete blood count, and it shows that everything is fine. That might not be true, or on the contrary, everything is fine with you, you get tested, and the results are bad. But it shows that everything is fine. Unfortunately, you always need to keep that in mind. That's why with any changes, a competent specialist, if he has even the slightest doubt, will always recommend that you retake the test. And in the same laboratory a couple of days later. Tip 2. Laboratory. Once you've chosen a lab, aim to consistently get tested at that same lab. Different analyzers, different reagents, different methods of performing tests, different laboratories use varying reference ranges. You yourself won't feel very comfortable if you monitor, for example, your sex hormones in different laboratories, and here the reference ranges are one thing, there they're another, and somewhere else they're different again. I mean not the testosterone numbers, but the units of measurement. You'll just have to spend time using online calculators to convert testosterone units, for example, into nanomoles, which are more convenient for you. And of course, medications. Many of you take supplements. You take some kinds of medications. Should you take the supplements on the day of the drug test or only after providing the sample? But if you take hormonal medications and you do this on a regular basis, for example, thyroxine for the thyroid gland, or if you rub in androgel, then you should definitely do what you do every day first and then go for the test. Because once again, you're interested in what you actually live with. And if you use androgel but you didn't apply it and went to take a testosterone test, then naturally your level will be low. And by applying it and then going to the lab, you'll be able to find out what your actual blood levels are. Another very important thing is that laboratories can also be different, and they differ not only in price but also in their environment. It's very important what kind of equipment is used in the laboratory. Remember, if the laboratory uses an immunoassay analyzer, the margin of error in such a lab is 20 to 30%. That's basically nothing. So, of course, it's preferable if the laboratory is equipped with mass spectrometers. That's more accurate. It's a bit more expensive, but at least you'll save your money in the sense that you won't have to retake the test 2 or 3 times. I can interpret many tests evaluating all of this through immunoassay analysis. But for you, those who are watching this video at home right now, it will be difficult to do this. Because if you want to understand the norms, the minimums, the maximums, then of course it's better to do this with a mass spectrometer. There is also saliva analysis, including, for example, for hormones. There is hair analysis for trace elements, about hair analysis for trace elements. Getting ready. In principle, some recommend not washing your hair on that day. In reality, that's complete nonsense. You can calmly go and take a trace element stool analysis. Does it also require any preparation? What kind? Well, it's considered that you should avoid heavy protein foods like red meat and red fish at least 2 or 3 days before the stool test. In general, it's recommended to avoid regular dairy products, but not fermented dairy. Regarding the urine test, it's also a very important point when you're taking a urine test. The main problem is that we always see inflammation there, and then we go looking for prostatitis treatment because we have leukocytes there. The problem is that we don't do it right, primarily due to poor hygiene. In the morning, you didn't wash up properly before the tests. You simply urinated into a sterile container. That's the first thing. Secondly, you only urinated. You had sex the previous night. Suppose you had a bowel movement earlier and the stool pressed against your rectum as it passed through. And now we get a little more prostate fluid, which we squeezed out with a dense stool into the urethra. That's why it's extremely important not to collect the first portion of urine, but to start urinating and without stopping collect it after 3 or 4 seconds. Place a sterile container and collect about 23, 30 or 50 milliliters to send for analysis. Hands are also often a source of infection. And when you are getting tested, it's very important what kind of laboratory conditions you are in. Let's say you collected and sent your semen for culture or polymerase chain reaction diagnostics. This is one of the ways to detect infection. Very often patients come to me and say, the urologist is treating me for this stubborn bacteria that just won't go away. He got tested once and found bacteria that typically only lives on hands, not the flora that's actually present. As someone who understands that it only lives on your hands, I tell them to stop taking antibiotics. Go get tested again. He goes, gets tested, and under normal, sterile conditions, everything is fine, that flora is gone. That's why it's extremely important to get the most benefit from tests and not waste money and time. Because if you go in the wrong direction, at best you'll only be wasting time. Today, we'll discuss which tests you need to take in middle age, when basically nothing is really bothering you, in order to do a basic checkup. Possibly at home if you have at least some basic knowledge. So stay with us and give us a like. I'm going to tell you now, in order to understand how your kidneys are working, how your liver is working, it's basically enough to do this in a laboratory by taking some tests. It's not necessary to do an ultrasound. For basic diagnostics, if you don't have any specific complaints, basically a test for different fractions of bilirubin will do. Bilirubin is what the liver removes from your body, and if the liver isn't working well, the bilirubin level will go up. It can also increase if there are problems with the hepatobiliary system. That's when bile flow is disrupted. So, if you have impaired bile flow, for example, due to the presence of a stone, your bilirubin level will be elevated. But it can also be elevated if you are taking certain medications or antibiotics that have, I would say, a toxic effect on the liver. Therefore, if you are taking antibiotics, all your biochemical indicators, including the ones I will talk about next, will be distorted. Because you're putting extra strain on your liver, it is best to check your liver function tests 2 or 3 days after stopping the antibiotic. The liver actually recovers very well. Just so you understand, when we have patients in our clinic, they come in and there is a rather large tumor in the left side of the liver, and there is also a fairly large tumor in the right side of the liver. One side can be preserved, the other cannot. The lobe of the liver containing the tumor is removed from the patient. In 1.5 to 2 months, the liver regenerates to its normal size. And then we can calmly move on to the second half. Can you imagine how many resources we have at our disposal? But what do you need to know about bilirubin? There is a very common disease called Gilbert's disease or syndrome. It's a congenital condition where your body doesn't eliminate bilirubin well because of a defect in the congenital enzyme system. Inherited genetically in 5 to 10% of the population, not everyone is diagnosed due to fluctuating bilirubin levels, which can be high or within normal range. And if your bilirubin is elevated, it doesn't necessarily mean that you currently have some kind of toxic problem in your liver. It's possible that you just have a condition you didn't know about, so you should go and get tested for Gilbert's disease. Liver enzymes like gamma-glutamyl-transferase, alanine aminotransferase, and aspartate aminotransferase will also show how well your liver is functioning. But you should remember that they can be elevated not only when you have liver problems, and their elevation is not always a problem. I often encounter situations like intense evening workouts, especially for powerlifters. The next day, he goes to get tested, and his alanine aminotransferase and aspartate aminotransferase levels are significantly elevated. He starts searching for information on the internet and reads that these are signs of a heart attack, signs of severe toxic conditions, or major liver problems. Just 3 to 4 weeks ago, everything was fine. This often happens. It's a post-exercise alanine aminotransferase and aspartate aminotransferase increase. That's why you should never panic right away if you see some increase, especially in the current situation, now that you know it can be caused by simple physical exertion. Sometimes it's enough if the lab is on a high floor like the 12th and you walk up there. This alone can cause an increase. LTS cholesterol. Many people think you should get it tested around the age of 50. Here we have heart attacks and strokes. Everyone is afraid of high cholesterol because in older people it causes heart problems. But if your grandfather, grandmother, mother or father had problems, specifically, for example, ischemic heart disease, this is when the blood vessels are most often affected by atherosclerosis due to high cholesterol levels and cholesterol metabolism disorders. And the lumen narrows, the heart's nutrition is disrupted, and when the heart lacks oxygen badly, pain occurs. If you have noticed or know that your relative had heart attacks or had problems with cholesterol levels, please monitor it from a young age, because at 50 or 45 years old, it could be a heart attack. The issue is that by the time you seek help, compensatory mechanisms and consequences have already developed, leading to complications. This typically begins at age 30, but can start as early as 25. So keep an eye on it. Maybe I should make a separate video about cholesterol in general, how to deal with it, how to influence it. If you want, subscribe to the channel and be sure to hit the bell. When I make the video, you'll be the first to see it. Regarding cholesterol, what exactly should you check? Triglycerides, total cholesterol, and there's also good cholesterol. That's why we don't just check total cholesterol, but we check more. Low-density lipoproteins are bad cholesterol. Low-density lipoprotein. High-density lipoproteins are good cholesterol, meaning the higher it is, the lower your bad cholesterol will be, because it fights against it. And if necessary, if there are indications, then apolipoprotein A and apolipoprotein B can be added, but I usually don't include them in the basic panel. If you have cholesterol problems, you definitely need to think about your lifestyle. First and foremost about your lifestyle, about how well or poorly you oxidize fats, whether you get enough physical activity, and how you eat. Because a little bit, yes, not the main part, but your diet still contributes a small portion. 5 to 15% of your lipid profile depends on your diet, another 5-15% on your lifestyle, and 5 to 10% on your hormonal system's background state. That's why you can have a significant impact without using cholesterol-lowering medications, which aren't very beneficial. Lipid profile level, and bring it down from a dangerous level to a more or less good one that you can live with, and not be afraid that at 45 or 50 you'll have a heart attack, because right now nothing will bother you. Cholesterol buildup on blood vessel walls, not blood cholesterol itself, is dangerous. This occurs gradually over time. Cholesterol often increases in people. By the way, when people come to see me, I always ask, if I see very high triglyceride levels or high cholesterol, how do you eat? Because many of them go on the trendy keto diet. Let's say yes, a lot of fats, and sometimes these are just the consequences of that kind of diet. So, if you see any biochemical changes in your blood test and go to the doctor with it, be sure to mention it. We'll get to the kidneys in a moment, and I'll give you another example of how diet can affect your blood creatinine levels. Surely, at some point in your life, a wonderful diet has improved it for the better, specifically in terms of your test results. If you have such an example or maybe an interesting product you'd like to share with us regarding its properties, please write about it in the comments. I think both I and everyone else will find it very interesting to read. Of course, very important parameters are blood glucose and glycated hemoglobin. Glucose shows how much sugar you have in your blood at the current moment, and glycated hemoglobin, it allows us to get an approximate snapshot of what has been happening in your blood over a long period of time, and the average level, roughly speaking, of glucose, because there is a part of hemoglobin that irreversibly binds with glucose, and that's exactly what we check. Diabetes is the #1 killer, I would say. It's actually one of the main causes of many oncological diseases. And why is it a killer? Well, here's a simple example. I was literally at my friend Pasha Losev's birthday party. There, as usual, I do this. I walk around looking for victim, as I call them. I observe people's skin, nails, and hair to assess their condition. By now, diagnosing people has become a professional habit for me. I've even diagnosed the cameraman sitting there. I saw a young man with a big belly and suspected he had problems with testosterone, even though he said everything was fine, his sex life was fine. But I said, don't try to tell me that. A belly like that with thin arms and legs can't happen to a young man without an endocrine disorder. I sent him to get his hormones checked, and I gave him the same checkup that I'm giving you now. His blood sugar levels were off the charts, and he called me trying to keep himself together, but you could tell he was worried. He immediately went on a diet. He already had diabetes. He used to sit, eat sweets, drink, nothing bothered him, but there were major changes even though he knew there was diabetes in his family. So why is it necessary to get tested before any symptoms appear? Because the later you detect it, the more likely diabetes will lead you to needing insulin, for example, or the less therapeutic options we have available. Because there are situations when you have problems with blood sugar, when you can adjust your diet, add medications that lower glucose levels instead of insulin, and you can delay the progression. Or you can even get rid of it if you have type 2 diabetes or a pre-diabetic condition. But the deeper you go into it, the later you discover the problems, the worse it gets. That's why glucose and glycated hemoglobin are a must-have in our tests. It's actually hard to assess it. There are a lot of these amusing tests now, like urine tests for various amino acids. Especially, many so-called doctors recommend taking these tests, although objectively it's impossible to identify a deficiency of certain amino acids through a urine test. Because today you might eat red fish, tomorrow you might eat steak, and the amino acid composition of the remains in your urine will be different each time. And it's impossible to understand what's happening to you over the course of 30 months. Daily testing wouldn't accurately reflect what's happening inside your body. It's more like quackery. So we forget about amino acids in urine. Now, albumin, which is a blood protein, yes, it's a good test. We do it and check because often, for example, if albumin is low, a person swells up, looks for the problem in the kidneys, starts taking some diuretic herbs, but the swelling doesn't go away. The thing is, this is called protein deficient edema. When there's little protein in the blood, total protein, albumin, then according to the law of osmosis, the blood leaves the bloodstream and goes into the tissues. That's why ladies who torture themselves with strict diets, or guys who think that the more time you spend in the gym, the more cardio you do, and the less you eat, the better it will be. They end up with hypoalbuminemia, which means a decrease in blood protein levels, and they get swelling in their tissues. They wonder why they're exercising and not eating, yet still getting puffy. It's very simple, because you shouldn't torture yourself. You should love yourself and know the science. Alpha amylase. Alpha amylase is what allows you to check how well or poorly your pancreas is functioning. Pancreatitis can increase lipase levels. In acute pancreatitis, you'll notice other symptoms along with the increase. With chronic pancreatitis, the increase will be slight but noticeable. This is another good reason to go and, for example, get an ultrasound of your pancreas and make sure everything is okay. General urine analysis. As a urologist, I probably can't even put into words how important it is. We can detect a lot of diseases through a urine test, and many of you think it's only kidney diseases, but that's not true. We can detect kidney diseases, cancerous conditions, kidney stones, prostate problems, bladder issues, and even problems that originate in the ureters. And this is probably the second most important test after a complete blood count. I've already told you how to collect it properly, and now I'll tell you what you shouldn't do when you're taking a urine test. What you definitely shouldn't do is use vitamins or dietary supplements. Taking high doses of vitamins can cause your urine to become very bright in color. The thing is, urine is a product that removes toxins from your body. And when you take vitamins, the ones your body can't absorb are excreted. The same goes for many foods that, for example, can change the color of your urine. Therefore, in order not to distort the interpretation of your test results and to get accurate results, try to avoid all coloring foods, all vitamins and supplements at least 12 to 14 hours before your urine test. And be sure to give your urine sample when you are not dehydrated. The second portion of urine should be collected after thoroughly washing the genital area. Women should not provide a urine sample during menstruation. And after 3 to 4 seconds of urination, without stopping the stream, we collect the urine in the container. Otherwise, the first portion of urine is what remains as sediment in your bladder or in the urethra. Consequently, you may get leukocytes or other substances. Therefore, this may lead you to incorrect diagnoses and unnecessary anxiety. Urea and creatinine are also waste products of tissue activity. And if your best filters, which are your kidneys and liver, are working well, then their levels will be normal. Urea is partially excreted by the kidneys, but most of it is eliminated by the gastrointestinal tract and the liver. If the hepatobiliary system malfunctions, its level may rise. This is a reason to consider whether there are any problems with your diet or with the functioning of these organs. Creatinine is probably the main indicator of how well your kidneys are functioning. The degree of kidney failure is determined by the numbers that creatinine reaches. And people who go on dialysis simply can't remove tissue breakdown products from their bodies. Creatinine levels become extremely high, potassium also rises significantly, and this can lead to a fatal outcome. That's why they get a kidney transplant, so that creatinine can be removed from the body. Actually, our kidneys have two main functions: removing water and eliminating waste products. In other words, the concentration function and the water excreting function. So you might urinate 3 or even 4 liters, but that doesn't mean your kidneys are removing enough toxins and waste products from your body. Even if you urinate well and a lot, it's possible for someone to urinate like that and still soon need dialysis. The composition of urine is as important as its amount and color. That's why there are so many parameters in a urine test that can tell us whether the kidney is coping with its functions. For example, the density of urine. Creatinine, on the other hand, shows how well things are going in the body overall. A very important fact: if you are on a keto diet, if you consume a large amount of protein, you may have high creatinine. This doesn't mean you have kidney failure, but it does mean that you're putting a lot of strain on your body. And unfortunately, your needs are not as high as the requirements of your athletic goals. So you're overeating protein and your body can absorb that much protein, or you're on a diet that simply implies, for example, ketosis, like the keto diet. It's crucial to know that if someone has kidney issues and high creatinine levels, the primary recommendation is to decrease protein intake in their diet. If you have very high protein levels, don't force your body or strain your kidneys. In fact, I urge you not to overeat protein at all. Even bodybuilder athletes, because people compete in the Mr. Olympia competitions in the super heavyweight category, consuming 2, 5, at most 3 grams, while some of our lightweights eat 3, 3.5, 4, even 5 grams. Naturally, if you have a predisposition, it will end very badly. If you remember the famous athlete Flex Wheeler, what caused all his problems in the end? His health issues were due to his kidneys. He had one kidney removed, which led to problems with the blood vessels in his leg. I think that's also a consequence of this systemic disease, because the kidney doesn't just shrink. You can even develop an autoimmune disease like glomerulosclerosis. Anything can happen. That's why I'm strongly against abusing protein. If you see that you have a lot of creatinine and you eat a lot of protein, well, on the one hand, it might normalize if you adjust your diet. On the other hand, it's a sign that your body can't digest as much as you want, and you're still walking around. Your bloated stomach resembles pregnancy due to protein malabsorption and fermentation in the intestines, leading to discomfort and suffering. So friends, never overeat protein. You won't get bigger, stronger, or smarter from it. You might ask, how much protein should an average person eat then? On average, I usually recommend about 1.2 to 1.8 grams of protein per kilogram of your body weight. That's the maximum if we're talking about health and longevity. And that means, for example, if I weigh 110 kilograms, I can eat up to 160 grams of protein. Not chicken, not tuna, but specifically protein. So you look at the protein content because all of you have different levels of knowledge in nutrition. And regarding another very important and common question, many nutritionists, some count it, some don't. Plant protein. I mainly count only animal protein. I don't count plant protein or fiber. Why? Because first of all, the amino acid profile of animal protein is different. It's complete. The amino acid profile of animal protein suits us best. Plant protein is incomplete. That's why vegetarians and vegans who don't eat, let's say, meat, they do have this issue, and it's foolish to deny it. There are a number of diseases and conditions that are caused by the fact that they don't get a complete set of amino acids. I believe that plant-based foods cannot be the foundation of our diet. There should be a moderate amount of seafood, white meat, red meat, greens, vegetables, and all kinds of fruits. That is, we should have a balanced diet. We shouldn't limit ourselves to only eating meat or only being fruitarians. It's a big mistake for all those people, no matter how great they might feel right now. Unfortunately, according to the tests, we see a lot of problems in most of them. The main male sex hormones are luteinizing, hormone follicle stimulating, hormone total testosterone, free testosterone, and sex hormone binding globulin, which is a protein that serves a transport function. There's no point in just going to get a testosterone test separately, or just getting a luteinizing hormone test separately. That's why I didn't talk about each of these hormones separately. Luteinizing, hormone follicle stimulating hormone total and free testosterone, and sex hormone binding globulin need to be tested together. Why is it necessary to test them together? They work as follows. Luteinizing hormone and follicle stimulating hormone are released in the brain, specifically in the pituitary gland. They travel to our testicles, and follicle stimulating hormone makes the testicles work to produce sperm and to allow sperm to mature. So, follicle stimulating hormone is what makes you fertile, and luteinizing hormone is what allows you to produce testosterone. Luteinizing hormone acts on the testicles, and under the influence of luteinizing hormone, Leydig cells produce testosterone. If your luteinizing hormone and follicle stimulating hormone levels are very low, even with the healthiest testicles, you will have problems. So, one of the conditions you might see in your test results is hypogonadotropic, which means that luteinizing hormone and follicle stimulating hormone are low, or hypogonadism. This means that because of this, you have low testosterone. The second condition that we sometimes see is hypogonadotropic hypogonadism, which means your luteinizing hormone and follicle stimulating hormone are high, but your testosterone is low. This indicates that the brain recognizes the need for testosterone and spermatogenesis stimulation, but the testicles are unable to produce it in response to the stimulation. This means that they don't have enough capacity. It means that the testicular reserve is reduced, and it could be that the density of the testicular tissue is decreased for various reasons: genetics, viral damage, injuries, or age. Your sperm analysis results vary at ages 20, 40, and 60. Interestingly, sperm analysis reports do not typically adjust for age. Why do you need to test luteinizing hormone, follicle stimulating hormone, and testosterone together? Because the feedback principle works, and they are dependent on each other. And to understand what your problems are related to, you might see that you have low testosterone. You might think the problem is in the testicles, but it could be in the pituitary gland. Maybe there was a pituitary injury, some kind of hematoma, and because of that you have empty sella syndrome, you have a small pituitary gland. And you simply can't produce as much as you need because there's no stimulation. But with gonadotropin injections, you'll have good testosterone production. On the other hand, if you have high luteinizing hormone and follicle stimulating hormone, but low testosterone and no gonadotropin, most likely it won't help you. because you're already in a state of hyperstimulation. You already have high luteinizing hormone and follicle stimulating hormone. There's also a third problem. You might have good luteinizing hormone and follicle stimulating hormone. You might have very high testosterone, and that reassures you. Well, for some people. In the comments under the video, I read all your comments. You write, what about my testosterone? I think it's a man writing. 65 years old, testosterone is 35, and there are complaints, but the problem isn't the testosterone. At the same time, I ask, what about sex hormone binding globulin? And he doesn't know. Sex hormone binding globulin is very important. Right now it's being discussed a lot, but mostly by bloggers, not really professionals. Sex hormone binding globulin is a very important parameter. You definitely need to pay attention to it. If sex hormone binding globulin is significantly elevated, even if the total testosterone in the blood is good, even high, or even normal, the free testosterone can be normal. When a person has high sex hormone binding globulin in their blood, the free testosterone value is often incorrect. And you can get a more or less accurate result if you test your saliva, specifically saliva, by doing a multi-steroid saliva profile for sex hormones. Only then will you see that there really is little testosterone. A person often goes to a psychotherapist or a urologist for years treating prostatitis. No one can figure it out because many practitioners don't even use sex hormone binding globulin. He has high testosterone. And over the past year, I've probably had, to be honest, about 200 patients like that come to me. After 5 or 6 years of treatment by urologists, already with complications from long-term conditions with low testosterone. That is, testosterone was within the normal range, but it wasn't working. When I see videos claiming sex hormone binding globulin is irrelevant, that's nonsense, naturally. And remember, if you are in compensation, the body, due to high sex hormone binding globulin, is forced to compensate with high testosterone. In this mode, the testicles will quickly use up their reserve. If you can exist in this mode for some time, then later the testicles will simply get tired early. That is, this will lead you to early hormone replacement therapy. And often, by the way, this is the reason why you have high total testosterone, high estradiol, and high dihydrotestosterone. These people, even though they have problems with potency and weakness, still experience significant hair loss, develop gynecomastia, and have swelling. Sex hormone binding globulin is probably the most underrated element in hormonal system analysis. That's why the normal range for sex hormone binding globulin is not what is written on the right. This is the main mistake people make when they look at it. It should be roughly equal to your age. So at 20, sex hormone binding globulin will be about 20. At 30, it will be 30. Small fluctuations are acceptable. In my experience, an increase of more than 10 to 12 can already cause clinical changes. I'm not saying that everyone definitely needs to lower it. I'm not saying that all problems come from it. But you should always pay attention to it. It always has some impact. And I don't lower it for everyone. But if I suspect that this particular patient has clinical symptoms of testosterone deficiency, then I will work on lowering it for him. Sex hormone binding globulin restore it, and that's the best thing we do. We bring sex hormone binding globulin back to normal, sometimes even lower it. His testosterone becomes normal, and even though it didn't get higher, his complaints and symptoms start to go away. Even though at this moment I don't specifically add any suppositories, I don't give any vitamins. I'm just working on correcting sex hormone binding globulin so that the person understands that all his complaints are related to a hidden hormonal deficiency. When testing luteinizing hormone, follicle stimulating hormone total, and free testosterone, it's crucial to include sex hormone binding globulin too. And of course, it's preferable to do this on equipment with a mass spectrometer, but personally, I can also look at it on an immunoassay analyzer. It doesn't bother me. If, once again, you're used to relying on the minimum and maximum values on the right, then of course, it's better to do this in a more expensive, higher quality laboratory. Estradiol and prolactin, female hormones, as many of you call them. They're not female hormones, they're just hormones. There are no female hormones, there are no male hormones. There are simply different hormone levels in different people. For women, prolactin naturally determines many things. It's more important and more necessary than for men, and its level is higher, especially during lactation. Men also need prolactin, and men need estradiol as well. Estradiol is not a female hormone either. Right now, anti-estrogen therapy is very trendy. There are several bloggers. I'm surprised they haven't been jailed yet for practicing without a medical license. It's only a matter of time before they are arrested. When they treat people by prescribing hormonal drugs without being doctors, without having a license. If you want to be a doctor, go study. So, estradiol and prolactin are very important, even for older women. Have you noticed what's the most common injury among grandmothers? Neck of femur injury, hip fracture, and osteopenia are common due to lack of sex hormones and inadequate hormone replacement therapy for women. This leads to osteoporosis, falls, and hip fractures. In men, if there's an estradiol deficiency, the same thing will happen. That's why men who are on improper cycles, who suppress their estradiol to zero to look leaner, as they think, as a result, libido decreases. And even with good testosterone levels, there's no libido. Because yes, libido in the male body largely depends on estradiol. Too much estradiol is bad, and too little estradiol is also bad. And if you want to be healthy, you shouldn't associate estradiol and prolactin with female hormones. If you're on a cycle, you don't need to try to lower it to a minimum. It should be within the normal range because harm begins where the maximum ends and where the minimum begins. So please never do anything blindly, especially you, fellow bodybuilders. When you feel like you're getting tearful, you have a lump in your throat or you start swelling and you're on testosterone, then most likely aromatization happens because estradiol is produced from testosterone in the male body. There's an enzyme called aromatase which takes your testosterone and turns it into estradiol. There are medications that block the action of this enzyme, either destroy the enzyme itself, its production, or prevent it from working. And this leads to very bad consequences. When you do densitometry for such patients, their skeleton at 40 or 45 years old looks like it's 70 or 80. Many of these changes are irreversible. Estradiol and prolactin are necessary hormones. Prolactin levels can be elevated. There are many reasons for that. You can take a hot bath, you can get nervous, and it will be elevated. Don't immediately rush to get a pituitary magnetic resonance imaging retest in 3 days to a week. If it's still elevated, consider the degree of elevation. If the increase is about 15 to 20%, you most likely won't find anything on the magnetic resonance imaging, because there is a slight correlation between the size of the pituitary adenoma, that is prolactinoma, and the amount of prolactin produced. When the increase is really significant, 80%, 100%, 200%, then you need to get a magnetic resonance imaging of the sella turcica and pituitary gland to check for a prolactinoma. This is a benign tumor that releases prolactin into the blood. To choose a therapy, first check if the hormone is active, prolactin, or inactive. If it's active prolactin, you may experience erectile dysfunction and lack of libido, which are the main symptoms of increasing prolactin levels. By the way, for example, during ejaculation, one of the reasons for the lack of desire after ejaculation is actually a spike in prolactin. Then you start taking medications that reduce the activity of the prolactinoma. This medication hinders its effectiveness over a period of 6 months to a year, sometimes even years with extended use. It's possible that because we don't let it work for a long time, it will shrink, get smaller, and we can avoid surgery and radiation. So please don't see all hormones as good or bad. There are no good hormones, there are no bad hormones, there are only not very suitable tests. And what I definitely want to assure you not to do is to take tests and look at what's highlighted in red, what's in bold or black, and compare it to the normal range. Interpreting test results is a different skill. So, in addition to what you learned today about which test to take, I strongly urge you not to self-medicate. If you have any problems, any complaints, or any doubts, please leave it in the hands of professionals. There's also something called polymerase chain reaction. Nowadays, everyone probably associates polymerase chain reaction with swabs from the nose or mouth. The swabs taken during your coronavirus test were sent for polymerase chain reaction diagnostics, which is how the polymerase chain reaction diagnostic process works. Actually, we urologists have been working with it for a very long time. A lot of sexually transmitted infections are detected, and of course, we talked about hormonal and general clinical tests, but we can't forget to mention infections as well. The best way to detect sexually transmitted infections is to take a urethral swab for polymerase chain reaction diagnostics. Sometimes it's 912. The number that comes after polymerase chain reaction is the number of sexually transmitted infections you're being tested for. An alternative option exists, but urologists have varying opinions about it. For preventive diagnostics of the body, providing a semen sample for polymerase chain reaction testing is more comfortable. Collect the semen in a sterile container, bring it in, and request a polymerase chain reaction test specifically from your ejaculate, although many may refuse. Because its informativeness basically will be almost the same, the difference will only be a couple of %. And another very important test is a culture, sometimes it's a urine culture, which if you have any problems specifically with the urinary tract, sometimes needs to be done. And the second is a semen culture. Yes, that's right, sometimes you can also have to provide a semen sample. Because what's happening inside the prostate? What kind of bacteria are there, good or bad? After all, prostatitis is still a thing. This condition exists, and for some patients we avoid blindly prescribing antibiotics that don't effectively treat it. Sometimes it's better to wait for the results of the bacterial culture and then prescribe the right treatment based on that, which will actually help the patient. Well, of course, vitamins. There's a lot of controversy about them, and right now there's a lot of talk both for and against. Well, as they say, you can't push science forward and you can't go back, so let's push it sideways. I think that vitamins really do need to be monitored and checked because a lot depends on them. Even a vitamin deficiency is one of the reasons for low testosterone. But I think it's worth making a separate video about vitamins. It will definitely be released on the channel, and if you subscribe, you'll be the first to know about it. And probably the last thing we'll finish with is calcium, potassium, sodium chloride, and probably the most important, iron and ferritin. Iron, because unfortunately sometimes your test doesn't show it. True iron deficiency, which we can suspect in a complete blood count by changes in cell size, and which we can also suspect by a decrease in hemoglobin and red blood cell levels. Your iron levels may be normal, but checking ferritin will be more indicative. But an important point you should know is that ferritin sometimes increases in certain oncological diseases and also rises during inflammation. That's why iron deficiency can't always be detected by ferritin alone, and if a person clinically has iron deficiency, I usually send them for additional tests even if it's based on ferritin. I didn't see it, but I suspected it based on soluble transferrin receptors. Their feature is that they don't depend on the inflammation factor. A basic checkup for men over 30, 35 or 40 years old should include a blood prostate-specific antigen test. In many countries around the world, they no longer recommend routinely taking the prostate-specific antigen test, but in our country it is still recommended. But one of the reasons it's not recommended is because it detects clinically insignificant cancers, meaning cancers that may not become the cause of a person's death. My approach is a bit different. I believe it's better to suspect it in time, because we don't always see the presence of cancer just by an elevated tumor marker, but rather by the dynamics of its growth. And that's why you can have a good result at 35, a slightly higher one at 37, and even higher at 39. Even without reaching the threshold value, this is an indication that you should pay attention because something might be wrong there. That's why, personally, I recommend checking total prostate-specific antigen, free prostate-specific antigen, and the ratio of total to free starting at 35 or at least at 40 years old. I definitely recommend getting these tests done. I want to somehow sum up so that we have some kind of logical conclusion. I probably seem stingy or like a jerk when a stranger writes to me and asks, what tests should I take? Well, basically, as many of you wrote in the previous video, make a video about tests. But if there were a single way, a single diet for everyone to lose weight, if there were a single template for how to learn a language, everything is very individual everywhere. And it's silly that you're trying to find a psychologist who suits you, to find a soup you like, a recipe. Essentially, an individual approach is sought in absolutely every aspect. For some reason, when it comes to tests, you think you're just a copy of another organism, but you're so unique, your life makes you even more unique. We all have different fingerprints, we all have different lifelines on our hands. We are born different, coming out of our mother's womb. And life, which plays with us, punishes us, changes us, we grow up, we get older, all of this changes us even more. And that's why an adult is an extremely unique being. And it's impossible to find a specific guide that will suit you perfectly. If you have any complaint, if you have any problem, 100%, of course, you should start with a basic checkup. But it's impossible to create a checkup for every situation that won't miss a disease or rule something out. Unfortunately, it's better to get tested than not to get tested. But if you have certain complaints, my strong advice to you is not to treat yourself using the internet, not to look for answers on YouTube, but to go to a good specialist whom you trust. And let him, after examining you, talking to you, filling out questionnaires, studying your complaints, your history, and maybe even examining you physically, prescribe you the right set of tests. Because taking all these tests, first of all, is expensive and sometimes it's not necessary. And it's a waste of time, and time is the most valuable thing. So please love yourself and treat your health with respect, then it will repay you in kind.